Hello, my name is Dr. Katrisa L. Ford, better known as Dr. Kat Ford, and today I'm going to provide you with tips and pointers on how to work with adolescent teen mothers, aka teen moms. So one of the first things that you need to understand is that teen mothers, adolescent mothers, they're often emotional. They're a big ball of emotions, and with that being said, oftentimes they're emotionally unstable. Their attitudes, of course, will shift. They're actually a lot of times moody. And not all of it has to deal with the fact that they're becoming a mother or that they are a mother. Keep in mind, they're teenage females. So the emotional piece is something definitely you have to recognize. Also, I've found that a lot of times these young ladies feel powerless. So when they feel powerless, a lot of times and oftentimes these young ladies are defensive. And last but not least, a lot of times the young ladies are just unsure and uncertain as to their future, what they want to do. So oftentimes this leads to a lot of confusion. And sometimes people misinterpret it as them not caring because they can't give you that direct answer to a question that you ask about, well, what are you going to do? What is your future? What are you going to do for your baby? And sometimes these young ladies genuinely, they do not know. When the young ladies are unsure and they do not know about their future, their thoughts, they sometimes struggle with making decisions. Oftentimes this is dealing with the fact that they have this identity confusion. They have a role confusion. Here they are, biologically, they're a teenage female. But then, socially, we need them to operate and function as an adult. And sometimes those two just do not balance. So again, it's leaving the girl in an utter state of confusion. Now that you have established and have a general understanding of what it is you're dealing with as far as adolescent mothers, emotions, feelings, and their behaviors, here are some tips that will help you be successful in working with these young ladies. Oftentimes, just a typical teenage female can be combative, they can be defiant, they can be oppositional. No difference with the adolescent mother. So one of the tricks that I always use with my young ladies was, I call it my Jedi mind trick. If you want them to do something, oftentimes present it to them as an option or a choice. For example, if Kim wanted to take her 6-month-old baby outside and it's raining, and her baby for the last 2 months has had 3 ear infections, ideally, you would want Kim to put a hat on the baby's head. But in Kim's mind, you know, the baby will be okay, she's just running from the house to the car. So instead of saying, Kim, you need to put that hat on that baby's head, instead you can say, well, hey Kim, hasn't the baby had ear infections the last couple of weeks or months? And she would say yes. Well, what do you think about putting a hat on her just in case? Because you know, last time you were up late at night because the baby had an ear infection and the baby had a fever. What do you think? Should we go ahead and give the baby a try and let the baby have the hat on? 9 times out of 10, she'll think, and she'll probably say, well, yeah, you're right. Oftentimes when adults ask these young ladies a question, it comes with a judgmental tone, and the young lady picks that up, and again, she becomes defensive. And other times when she becomes defensive, she'll either become argumentative and combative, or she just blatantly shut down. And if we're a public servant trying to help these young ladies, we can't afford to have that young mother shut down. So oftentimes, sit and take the time to ask them questions, and if they don't know the answer, just help them walk it through and make it a process. Anything you teach these young ladies, model how you want them to show their child. And good role modeling is another tip that will help, because when they feel like they can trust you, they'll listen to you, and when they do get in those trouble spots, you can be that trusted person they can call instead of trying to make a decision or make an irrational decision by themselves because they don't want to feel like they're stupid, or they don't want to call because they feel like they don't want to hear someone coming down on them again for making the decision for having a baby. Even though it's not her first bad decision, it definitely won't be her last. So if a young lady makes a mistake, praise them for at least even coming to you and being able to explain to you what the mistake is. Make it a teachable moment, but also always point out what they're doing well. Everyone likes to feel good about themselves. Everyone likes to be praised. And just the same as the teen mothers, it's equally as important, because when they feel good, they make their baby feel good. One other pointer that I would like to just add that I found that had me become very successful working with adolescent mothers was basically always showing a vested interest in what it is that they're doing. You know, sitting down sometimes is just asking how they're feeling and not always asking about their baby. Sometimes a lot of the attention is placed solely on the baby, it's not placed on the mom. And again, she's still a teenage mother. She still has wants, she still has needs, she still has desire. So sometimes in these troubled times, they need a listening ear, a non-judgmental ear, and most of all, a lot of times they just need a friend.